Hi, this is Dr. Mirrafati. I'd like to welcome you to Mira Medical Center. We're going to be talking about the route of implant placement, that is breast implant placement. There are multiple places that one can choose for the placement of, for the route for placement of the implant. The usual route is around the nipple areolar complex, and the old route was basically underneath the breast, which I don't know if that many people are doing that technique or using that route, because it basically scars your breast tissue and it is in the middle of the skin. However, both of those routes I don't like, partly because you have to cut into the breast tissue. The route that I'm more in favor of, and I think it should be the route of the choice for most patients, is the armpit route, or what we call the axillary route, or belly button or umbilical route. The belly button for me is a little too far away from the breast, and you do not have any feel with your finger as far as the pocket placement. However, when you go from the armpit or the axillary route, you very simply can reach the whole pocket with your finger and able to determine the plane that you're in, either subpectoral, which means under the muscle, or subglandular, which means under the breast tissue. Either one of those routes, and I'm more in favor again of the route in axillary, is that if it's done the right way, and this is the distinguishing factor from Mirrafati and the way we do our breast implant and other places, is that we do not use any cutting, any suturing, any bovie, any scissor, any traumatic dissection of tissue in the breast at all. In our practice, we simply make our incision into the skin in the armpit area, and then the rest of it is on blunt dissection. I do have a video on my website, youngerlook.com, that basically goes into detail as far as the instrument that we use to provide the pocket in subpectoral, which is under the muscle, or subglandular, which is under the breast tissue. I think when you go this technique, when you avoid the scarring, damaging the breast tissue, is the key element into having postoperative complications such as capsular contraction or rippling. The less damaging you are to the tissue, obviously the less problem you will have in the future. And in the same token, your recovery for that immediate postoperative care would be a lot sooner.